No, with the oh. Okay, so you got the nasya paper? Chapter? Okay, nasya. Yeah, one more mile. So, have you done before? Nasya, anybody? No, no, no. Okay, so nasya is the only therapy which is included in Panchakarma. Right? Rest all is no, not in this Panchakarma therapies. Let me just start recording. Because I will record. Let me just remove this too and clean because every time you put hand here and they have put the camera here. Okay. Let us start recording also so that the girls who are missing they can see. Okay. So Natya is the only as I was telling you, only Panchakarma therapy. We call it Nasya. Nasya means nose, medicine going through nose, right? Okay. And this is the only therapy which we do in the regular clinics in OPD level, which is included in the Panchakarma. Rest nothing, Shirodhara, massages, this, that, nothing is included in Panchakarma. Okay, so it means such a strong therapy, right? And in Panchakarma, you know what are there in Panchakarma? So Panchakarma is Virechana, Basti, right? Nasya, and Vamana, and bloodletting. These are the 5 therapies in Panchakarma, which is for cleaning the 3 doshas. So Virechana is basically for Pitta. In that, we give medicated, I'm recording. We give medicated elimination. You can say diarrhea kind of thing, but that is medically induced so that your gut is clean. Okay, so we give medicines first, prepare the body, and one day you need to be in the bed. You cannot move. And panchakarmas are like treatments where your whole body, your all cells squeeze out everything, right? Because in our body, as you know, that there are 2 mediums, water-based and oil-based. Just 2 mediums are there, right? So in water-based medium, we keep on cleaning continuously, right? I'm not sure if it is attached or not. Okay. So we keep on cleaning our body through urine, through sweat, right? But the oil medium stays in the body. If anything is mixing with the oil, it stays in the body. That's why we do not use too much of vitamin A, vitamin E, oil based. No? So we do not use them much. They will tell you that we should not use too much of vitamin A, too much of vitamin E, because it does not go out. Vitamin B, C, okay, keep on taking like 6 months. If it is more, it will come out in the urine, right? But these will not. Okay, so here what we do is we give you medicated oils, basically according to the problem. Keep body saturated, pump oil in every cell, medicated oils, right? And then we take it out. So one day we give for the, so all these panchakarma therapies, what people say is not true. That is not panchakarma. That is just money making, giving you some massage and this and that, and that's it. No, that's not panchakarma, right? So that is Virechana, and mostly pitta or just the cleaning we do with this therapy. Next is Basti. Basti is like edema that you put medicine to in us, but in enema, what they do is soap water, plain water, right? Just to clean your intestine, which can destroy the bacterial flora of your intestine, right? Here, we do not do that. We put medicines inside you, okay? So we push the medicines to us and it is absorbed from there, okay? So that is Basti, and with this we treat Vata. You know why? You know why? Because it's a very um, good thing to know. Vata, we cannot keep like Virechana, take out. Vata is already empty. You want to sit down? Tired? You're okay? Otherwise, you can take care. No? Okay. So, Bhakti is for Vata, and for Vata, we just cannot take out. Vata is already the space in the body, and we need to nourish Vata, nourishment. We cannot make it take out and make it more dry, more bad. So here we do the nourishment. We push the medicines inside and through large intestine it is absorbed. Okay. So that is the Basti. That is very, very strong treatment for Vata problems and including the aging. Okay. Then is, we will talk about it later. Then is Vamana. Vamana we do for this area, chest area. Okay. And in Vamana, we make you vomit. Okay. So same way, first we treat the body. We treat the body with the lots of medicated oils. Okay. We give you lots of medicated oils, no food, just the ghee. And your body is full with oil, right? Then one day when it is full, we take out with the vomiting, we give medicine to drink and you vomit in front of the doctor. So not at home because it can be dangerous. So it can be like half bucket full of. So yes, so this is the therapy which people will not find very comfortable to do. And if you are not a specialist, you cannot do. Like I have the post graduation in Panchakarma, so I'm very well versed with these things, and we can perform. But in the clinics, they will just by chance, even if somebody tries to attempt these therapies, they will be maximum doing duration, giving you some half doses of ghee, not to the full strength, just small doses of ghee, and will give you something to for diarrhea and will say, okay, you are done, right? I heard that in USA, they are shamana they are doing. So they are also doing something like that. Because as I told you, the old healing systems were more similar. So one of my students, she went to Hawaii and she was writing to me that they are also doing something like this in shamana therapies. Anyway, so this is for kapha. Yeah, kapha. Vamana. You see how the small children are first kapha stage, right? All the small babies have kapha stage. Okay. Second, have you seen when they are sick, they will vomit. They will always vomit, and you can understand they are sick. And if any of you have experience with the small children, you will see that when they vomit, it's very mucus. It's not vomit like us. It's more mucus, kapha, right? So kapha is vamana, and you will not believe when we do these therapy for asthmatic patients, asthma, or people who have lots of congestion in the chest. Trust me, when the person is vomiting in bucket like half 40 liters of vomitus, you take out, you just will pick up everything. It's so mucus, so much mucus, thick, heavy mucus that you put that and it will be like, will be so much mucus. So this I have done in my practice. I You will not believe how much kapha comes when we do it for asthmatics. And for chronic asthma patients, we tell them before springtime when there's a kapha time, bad kapha time. So before springtime, we ask them to repeat every year, and the episodes of asthma slowly goes down, right? So uh, in my practice, I have done this. 40 liters of the mucus came out, you know, and it's so thick because we have to check. So if you put hand and pick up, it's so thick mucus, so thick, right? So that is the number one panchakarma for kapha problems. Okay. Then is bloodletting. Uh, so we remove blood by different methods. By uh, how you call in Japanese, hirudin, that sucks the blood, medicated one. In China also they use, yeah. We in leech, we in English we call leech, which is in the water, yes. Like cupping, but this is an animal. This is a small blood sucking animal. Hiru. Yeah. So yes, leech. In English, it is leech. So we have medicated leech. Not every leech, many leech can be dangerous and poisonous. We have medicated leech, and we keep it. And if this is a leech, so we make it very hungry first. She should be hungry, and then if like we have to uh, put it here because this part is totally swollen, inflamed, or tissues are very bad. So we just make little cut here, blood come out, and then we put it here, and she will suck all the bad blood. And then we do not leave this like this for dying with the bad blood. We squeeze it. In Ayurveda, it is very important to make the animal live again. So we squeeze, and she vomit all the blood. We squeeze it, and then we put on turmeric on it, and she vomit all the blood. and then she's released back. But she will not be used for medical purpose again for another 7-10 days, right? Or next is cupping, and another way is just make a cut and let the blood come out. So these are the ways of bloodletting, and mostly pitta disorders, blood related disorders, we treat by this method. Now, these are the four. Number fifth is what we are going to do today. That is a very, very powerful panchakarma. Okay. And what it treats all the problems above this area. Cervical, brain related problems, ear related problems, eye related problems, gums problems. Why? Because, according, okay. So, because, see, how is the human body? Let me just put this. So this is nose, this is mouth, right? And here is the brain, this is eye, here is the brain, okay? This is the area of the nose. These are the food pipes, right? This is the area of the nose. Here is a bone, that is the bone which is holding your brain, right? So this bone is the only bone in human body which is like a sieve, uh, a strainer, filter with many holes, like a sieve, like a sieve, like a net, with many holes in it, which has many holes in it. Why? Because many nerves, eyes, ear, teeth, this, that, so many nerves come out. And this is the place from where the right brain, left brain, all the, cross. This is the only bone which is very porous. Uh, from where you can filter, can cross. This is the only bone which you can cross, right? So in the nose, when we put the medicines, so in this area, this a whole area is nicely lubricated, and all the nerves get nourishment, stimulation, nourishment, and good arrangement. And in the human body, this here are the lungs and heart and then all the organs. So this is the clavicle bone, and we have the vertebral column here. So above this area, all our governing power is there. Rest is just like helping, no? Thinking, eyes, skin, all the five organs basically is there, right? Very strong area. You will see whenever if you fell down or there is some accident. So what is your reaction? Is like this, save, save, right? So everybody's reaction will be like this, right? So hit me here, there, wherever you want. I just natural reaction, no? So because this area is the most powerful area of the body, all our government is here, like a capital city, right? So nasya is very important. It's a very strong anti-aging. It moisturize your nerves. It's very good for spondylitis, this area problem, nose problem, weak eyes. If you want to target one thing that I want to, rejuvenate all these, nasya is on the therapy. right? And it's a major therapy like Panchakarma, but still we can do it very easily. Okay. Um, okay, before I forget to tell you, we will read it later. I should not forget. So, nasya is of two types. Uh, Pratimarsh and Marsh. So Pratimarsh is which you can do daily and which we do in the Dinacharya. You remember I told you that we will be putting just like we put like little bit of the like one drop of the oil, and in your daily use you can use almond, you can use ghee, you can use mustard, you can use any good quality organic oil you can use, or you can use nasya oil also, right? Nasya oil will be medicated one, sesame oil, but if you do not have them, you can use any oil, which will be certainly will be of help because vata is controlled by oils. Okay. Ghee also you can use, but generally we do advise too much of ghee because it's cold. It's cold, and the coconut oil is also cold. So, but ghee, apart from ghee, ghee also you can use after making it warm. Okay. But oils are better. Okay. Sesame oil, our all medicine like nasya oil is also made in sesame oil. So that is the daily one which you can use daily. Marchanasya is something which we do in the clinics for the purpose. I have patients who have been operated upon for the sinus problems, but still it was not cured. Okay. And we can do it with the nasya. We can very well handle sinus problem with nasya, right? And just not the sinus, but everything else. If you have tinnitus, sound in the ears, or you have weak five sense organs, hair fall, weak eyes, uh, problem in the teeth, anything you can treat by nasya. Okay, because all the nerves will be going through these tissues, particularly the nerves problem. You can handle very well. Okay, so what we will be doing in the clinic will be the Marsh Nasya. What you are doing is Pratimarsh, which you just can put on the drops anytime, and 15-20 minutes you can wait and you can carry on with your work. Okay, but Marsh Nasya is what we are talking about now. Okay, clear? So let's read the chapter. The application of putting medicated oil or powders in the nostril is called nasya. So we can use powder also, we can use oil, depending on the case. Okay, so if too much kapha problem is there, then we use powders. Okay, otherwise, if just for rejuvenation or other purposes, then we prefer oils. This is one of the major part of Panchakarma procedure, as I told you, that it's a major Panchakarma. In this treatment, we take care of the upper part of the body like head and neck. We need to select the oils or powders according to the problem and preventive measures. Um, what is that? Henkang, epilepsy. Henkang, okay. Okay, so that also we treat by nasya. It is done in 3 steps. The area for medicine is prepared and circulation is increased, so medicine can work effectively. So with suitable oils, head and neck area is massaged and then steam or fermentation is done. In the main procedure, oil drops are put according to dose in the nostrils of the person, which he draws in, and once it activates the energy points and work on the mucous membrane and absorb, the rest of the medicine is spit out. After the procedure, warm water mouthwash can be done. Benefits: it relieves the problems related to head and neck, reduces problems like cervical pain, epilepsy, facial paralysis. It removes headaches, sinusitis, allergies, and all other problems of sense organs like tinnitus and other ear problems, eye problems, and nose problems. Contraindications, one should not do in bleeding, injury, or unconscious patients or new fever. So in all these things, we should avoid. But in all chronic problems, we can do it. Okay. Any questions so far? How shall we start doing? Hmm? Any question? No? Huh? Because that is again problem of the nerves in the brain. No? So of course, not just only nasya, we will be giving medicines also, but nasya is again a very powerful therapy to give. Okay. So another thing is now, so when we give nasya therapy, let me first explain and then we will do. So when we do nasya therapy, uh, we keep on increasing the doses every day. It will be for 5 to 7 days or 14 days. Okay. So continuously we prefer, but some people if have problem, then alternate days also we can select, but not more than that. Generally we say daily for 7 to 8 days or 14 days. 14 days. Okay. So that is one thing. Other thing is that when you come to the for the therapy, then we do not allow food in the stomach. So should be empty stomach or have taken the light food 2 3 hours before. You should not be exposing yourself to the extreme temperatures or extreme works, like any kind of physical work or any kind of extreme environment change, like rain, snowfall, or harsh sun, or too much winding. No, so you have to be very careful. Even if the weather is like that, you need to cover up yourself and be in the um, normal situation, normal weather. Okay. So these are few precautions what we need to take. Okay. And how we do it? Let me just show on someone of you who will be coming to the table. First, you can watch and then you can perform. I have put one yoga mat there with a bed sheet. So one or two people can practice there and one or two people can practice here. Okay. Or you can practice on sofa also. So let me first show you on somebody. Okay. Take we really need it for if she requires it or not. Okay. Are you full? So too much full? Oh, my stomach. Uh-huh. Okay, so we will use small doses. Please come. Please come this way. Okay. You can remove your shoes. Be on the table. Hmm. Legs this side and lie down. Little bit more down, more down, 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 down. Yeah. Okay. So uh, this is my. You can lie down. This is my personal thing that I always prefer to cover, but it's not necessary, and many people do not do that also. So you can cover the client first, okay? And then we need to give a little 10-minute massage here on this area so that we can stimulate, okay? So we can stimulate the area and circulation can be increased, okay? So just give me a second. I have some kumkumadi oil. So we will be using kumkumadi oil. If it is not warm, you can make it warm by putting it in the warm water. So always keep water with you, warm water always should be there. So I made it warm, and then your hands and everything should be warm. This is kumkumadi oil. Okay. So like this, you can take oil in your hand, but ask for the allergies if a person is having any kind of allergy. Okay. Same way, like from up to down, like this. Yeah, 7 to 10 minutes. You can see if she's absorbing the oil. This is kumkumadi. Kumkumadi oil also we can use for the nasayam. If a person is having problem with pigmentation or something. Have you used our pigmentation or this kumkumadi oil? You have used. Oh, you have used of Kama. Okay. So, yeah, that is extremely expensive. They have made it. No, it's not that much. So our oil is 780 or 800, something like that. And many of my students who have injured their faces, cuts and all. So if you know Kyoko-san, she was in defense colony. So she had an injury on the neck. She fell down, and she said that just kumkumadi application, there was no scar. Yeah. Okay. So like this, you can do the massage, and you know we need to activate this area. You can spend time as much as you want to. Okay. And then we have to steam this area. So what you can do is you can do with the face steamer. You can take a face steamer and you can do that. You can also do like in the pan, take hot water and like this, okay, till you have sweat on your face. And another way is, which is very relaxing and comfortable way, is with the cloth. So I will just make it hot, and then you can just do it with this also. So in any way, you have to steam it. Whatever way is comfortable with you, that way you can do it. Okay. You can ask the client to sit down and put this pan in front and put a towel, cover a towel. Okay, like a tent. Okay, that is one way. If you have steamer, you can use steamer, or you can use hot towel. Yeah, steamer. Face steamer, like we do in the facials, and yeah, this is hot towel. So with the hot towel also you can do. This is very, very hot, so you have to be very careful. How is the ketamine? Very hot. Yes. Shall I keep it or not yet? No. Okay. So this is one way, because you have to always, for any panchakarma therapy, uh, oilation, that is oiling, and the sweating is very important to open up the channels. Okay. Now she's ready. What we will do is we will prepare the oil. We can use this oil. We can use nasya oil according to according to what we decided for the client. If it is for epilepsy, for some brain problem, some general problem, some sinus problem, anything. Okay, is it comfortable or hot? Comfortable. So we will make this oil also warm. Okay. Now, few things we have to be careful. Generally, for the treatment purpose, we start with the heavy doses, not like 1 or 2 drops. So we start with 6 drops. Okay, we start with 6 drops, and daily we keep on increasing, like 6, 7, 8, or 6, 8, 10, something like that. Also means in both side of nostrils. Okay, so that is very heavy dose. It can go till 14 or 16, whatever you have decided. So the oil will be dripping to the throat. Okay. So this oil you are not supposed to ingest. No. You have to take it in the mouth and spit. Okay. This is not for ingestion. So you have to make effort, like take out. Okay. Spit. Okay. So now she's done with the steaming also. Now we will be putting oil. I will be putting two drops only, not too much, because this is for first time for her. So I'm not sure how she will take it. So you have to hold the nose like this, and one, 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 and one here. Okay. Catherine, sir, can you feel it? Okay. So do it like this. Let it come inside. Okay. Sit down, down. Take this. Take it from the mouth. Spit. Make sounds. Make sounds. No problem. It's a small dose, but if it will be big dose, it will be coming to your throat. Anytime it is coming to your throat, you can feel it. You have to spit it. Okay. Is it coming? Okay. So you have to. So don't, no hurry. No hurry. Take your time. Take your time. Okay. So like this we do, and once she's done with the cleaning and spitting, if she wants to do, then we will be giving her herbal fumes to smell. Okay. I will be preparing that. And then if she needs little warm water, just to rinse the mouth, because there is that taste of oil in the mouth, just to rinse them out, and that's it. Okay. Okay. I will show you. अरे कौन है? So these are, this is the herbal tea. So, like this, make a picture. Just one or two times. Yeah. Okay. So, 2 or 3 times you can smell the fumes to activate the brain. This is the handmade. So, we have rolled the herbs. So like this, and then we finish it. And if you have some speak in the mouth, you can speak. And after that, you have to be a bit careful not to go out in the strong sun, or the AC should not be on your face. So you can be a little bit comfortable, but the AC should not be on you. Okay, so just comfortable and no air pushing on you. Okay, so how are you feeling? Okay, yeah, it can be very strong for some people, particularly if you have sinus problems and all. So then the steroids can be very, very sharp and like, did you try that, right? You are using our nasayam oil, no?
I was focused on
Very strong.
didn't think that was a try that for but I used to go to the kitchen and just I haven't used
Yes, yes, that is what, no, she's using for the daily one, just 1 or 2 drops. When we doing the clinic like this, so this will be the 7 to 14 days. And that will be not like 1 or 2 drops. Now go to 2 to 4 drops, okay? We will be going till 16, 18 drops. Where the oil will start coming like, right? So daily we will be increasing the dose. Every day, dose will be increased. This is in Panchagatra. Every day we will increase the dose. For daily, we just, that is for nourishment. Yeah, 1 or 2 drops. That depends again. If you want to use for face pigmentation or face problem, then we will be giving you the oil. If you want to use just for your overall well-being, can be different oil. Or as I told you, if you don't have anything, then you can use olive oil or almond oil or any kind of good oil. Yeah. So any questions? Shall I give you some water to drink or you're okay? You're fine? Okay. So then the doses will be high and patient will be spitting like too much. So then the taste of the mouth will be spoiled. You can give them warm water to rinse it. Okay. Okay. So now make a group of 2 and you can perform on each other and check how it is. Let me get some more powers for you guys.
Yeah. You want to try? You want to try on yourself, right?
Yes.
Yes, she already did. Okay, so I will get a few more towels and you can, one group can take this table and another group can take that one. And, oh, you can use the sofa also. If it is comfortable for you to lie on a sofa, so we can. If you want this on sofa, I can give both. So we will put the bed sheet on the sofa. How you want? So if you want, I will just get some more. So we just make two groups and. So make two groups and I will get some towels and we will start. We will start. If you have any question, you can ask me.